Tuberculosis. Tuberculosis is a contagious bacterial infection that mainly affect our lungs, but the tuberculosis also spread to the other parts of the body, for example, brain and spines. Tuberculosis is caused by a bacteria called Mycobacterium tuberculosis that causes the sign and symptom of tuberculosis. Tuberculosis was the leading cause of death in the 20th century, but today the modern medicine are available which treat the which tuberculosis can be treated with these antibodies, but it takes longer time and you have to take medicine at least 6 to 9 months. It take a longer period of time to recover tuberculosis. There are two types of tuberculosis or TB: active TB and latent TB. It's mean when you have germs, but these germs are not active due to the activity of the immune system. You have germs in your body, but but your immune system keep them away from spreading. Immune system is actively involved in from keeping the spread of infection of tuberculosis, and you do not have any symptom of contagious, but the infection is still alive, as the germs are there, but they are not spreading, they are not showing activity or active growth, but they are still alive. And you have if you have higher risk of if you have HIV and you had an infection in the past 2 years, your chest x-ray is unusual or your immune system is weakened, your doctor will give you medication to prevent an active TB. If you are cured from TB, if you have active TB infections and you get the medicine, but you are healthy, but doctor still recommends you the tuberculosis antibiotics because they are still alive in your body in case of latent TB infection. Active TB. Active TB means the germs or bacteria, Mycobacterium tuberculosis, germs are multiplying and you may spread the disease to the others. Tuberculosis is a disease that spread from one person to another person. The 90% of active cases in adults come from latent TB infections. It means you have latent TB or which is not showing any symptoms, and 90% of the active TB is get from the latent TB. A latent or active TB infections can also be drug resistance, meaning that certain drugs are not working against the Mycobacterium tuberculosis. Tuberculosis sign and symptoms. Lead TB do not have any sign and symptoms. Lead tuberculosis do not have any sign and symptoms. A skin or blood test can tell if you have it. Tuberculosis diagnosis with the help of test performed on the skin and the blood test. Sign and symptoms of active TB include cough that least for more than 3 months. If you have longer cough time period, then in the cause of the tuberculosis at high risk. Chest pain, cough up with bleeding. When you are coughing, blood is coming to your cough or septum. Feeling tired at all times, night sweats. Tuberculosis causes. It is a type of bacteria called the Mycobacterium tuberculosis that causes the bacterial infection tuberculosis. Tuberculosis is caused by a bacterium that spreads through air droplets, just like cold or flu spread through air. You can get TB if you have contact with the people who have it. You could be more likely to get TB infections if you are a smoker or a friend or a family who has the active TB infection. You can get the TB tuberculosis disease from that person because this tuberculosis disease is separate from person to person. And if you are a healthcare or a care worker, then it is a high risk of to get TB or active TB infection. Or you are living in an area where TB is common, for example, Russia, Africa, Europe. In these countries and continents, the tuberculosis infection is more common. Or you are working in a hospital or a nursing or healthcare department like the hospital, where many patients are coming and you are getting the disease from these patients. A healthy immune system fights against the bacteria, but when they are incapable to fight against the bacteria, then the chance of the tuberculosis increases, along with the other diseases appear with the tuberculosis, for example HIV or AIDS. Diabetes can also be accomplished risk factor of the tuberculosis. Severe kidney diseases, head and neck cancer, medication for organs transplant. If you transplanted organ or any medication, you will get the tuberculosis disease from infected person. Tuberculosis transmission. Tuberculosis are transmitted from one person to another person when you have TB cough, sneeze, talk or walk or sing. You release the tiny droplets that contain germs. It is not easy to catch the infection, but you usually have to spend a long time around the people who has a lot of bacteria in their lungs. And when these people cough, sneeze, talk, laugh, they are transmitting the bacterial infection into the air, and you are breathing in that air, and this increases the transmission of tuberculosis infection to the other person. And if you breathe in these air, you can get tuberculosis test and diagnosis. There are two main tests for the diagnosis of tuberculosis. The one is skin test. It is also skin test. A technician inject a small amount of fluid into your skin or arms. Skin or arms. After 2 to 3 days, they will check for swelling in your arms. And if your result is positive, you probably have the TB. And if your skin is in case if the injected fluid causes swelling in your arms or skin under the skin, then you have the active TB. And you might get these tests more than once. Blood test. The test called the interferon gamma release assays measure the response when the TB proteins are mixed with a small amount of your blood. These tests do not tell if you are infection is late or active tuberculosis infection. And if you get a positive skin or blood test, your doctor will learn which type you have it of tuberculosis, either active tuberculosis or latent tuberculosis. A chest X-ray is the main tool for to diagnosis of tuberculosis. CT scan or X-ray scan looking for changes in your lungs. Acid-fast bacillus test for the TB bacteria or your septum, that mucus that comes up when you cough. Your mucus or the septum is also tested for the presence of bacteria. Tuberculosis treatment. Your treatment will depend upon your infections, latent TB infection or active TB. And if you have latent TB, your doctor gives you medication that kill bacteria so the infection does not become active. You might get isoniazid, and if you will have to take the drugs up to 9 months. This is the longer period of time you have to get medicine, a complete course of medicine. And if you see any signs and symptoms of active TB, you will call the doctor or get an appointment. A combination of medicine is also given to treat the TB infections, but the these antibodies which are active against tuberculosis, the tuberculosis bacteria also develop the resistance against these antibiotics. TB drugs can have side effects. The most common side effects is of isoniazid and other antibodies. And if you quit too soon the treatment or antibodies of the antibiotics, you will get the TB infection again, and you will take them for 6 to 12 months. Whatever the kind of infection you have, it's important to finish taking all of your medicine even when you feel better. When you feel better and there is no coughing and sign and symptoms of the tuberculosis, but you have to complete all the course recommended for either 6 to 9 months or 12 months. And if you have drug resistance TB, your doctor will give you more than different medicine which are active or against the tuberculosis infection, and you may have to take them for much longer time, up to 30 months, and they can cause more side effects, and the side effects is more as the more antibodies you are using. Tuberculosis complications. Tuberculosis infection can cause complications such as joint pains, lung damage, infection or damage of your bones, spinal cord, brain, and lymph nodes. These are the complications which occur in result of tuberculosis infection: liver or kidney problems, inflammation of the tissues around your heart. Tuberculosis prevention. Tuberculosis to stop the spread of the tuberculosis, you have to, if you have latent TB infection, take all of your medicine so it does not become active and contagious. And if you have active TB, limit your contact with the other peoples because you are spreading the germs into the air. Cover your mouth when you laugh, sneeze or cough. These are helpful to prevent the TB infection transmission. Wear a surgical mask when you are around other peoples during the first week of the treatment. And if you are traveling to the place where the TB is common, avoid spending a lot of time in crowded places with sick peoples or healthcare professionals like the hospitals, nursing homes, where many of the people are sick and one of them maybe have tuberculosis infection. Tuberculosis vaccine. Children in the countries where the TB is the common get the BCG vaccines as during the infancy time period, and it is not widely used in the United States, but and it does not always give protection against the infection. Doctor recommend if only for the children living in the somewhere who has active TB infections with a very much drug resistance strain, or who cannot take antibiotics. Other vaccines are also developed and